Good morning. Can everyone hear me? Thank you. You can call me Emily. It's fine. So I'm Dr. Emily Murray. I'm Director of the Centre for Coastal Communities at the University of Essex. And really, I started in this role about 2 years ago, which seems to have flown by. It doesn't seem like 2 years ago. Really with the idea that it be a research centre. It's a cross-university research centre, but that it's really about what are the research questions that are important to our communities. So not just a bunch of academics up in our ivory tower asking the questions that we're interested in, but what really matters. And so a lot of the last 2 years has been about going out and speaking to the coastal communities and finding out what's important to them. So I really hope after I give this talk, come talk to me and tell me what you think about it. And particularly today, I'm going to talk about a lot of work we've been doing about young people in coastal communities in England and their mental health. And I'm not going to give all the answers today. I have some answers, some data, but I thought I would really set the scene a little bit, show you some of our research evidence, and then tell you how we're trying to work in partnership with our local communities. And just getting started on that. Etc. I'm sure this isn't news to anyone, but if we think about young people's mental health generally in England, it's not a good story. I think there's a lot of data coming out saying that 1 in 5 children and young people in England have a probable mental disorder. And then it's not getting better. This has been getting a lot worse over the last 10 years, since about 2010. Showing there's been a really sharp increase in the prevalence of mental health in young people. And it's not just England, this is across the globe. But it's not just a COVID story, it was starting way before then. And of course, this has resulted in a lot more demand on mental health services. I'm sure that's something that all of you are seeing. But if we know anything about mental health, it's not spread evenly across the country. And that's where I come in. My expertise is about geographic inequalities in health. And so this map here is showing the prevalence of mental health for all ages at a neighborhood level. And this is a small area mental health index. So it's brought together a lot of NHS data on prescriptions and service use, etc., to get an idea of the dark red being where that kind of prevalence of mental health is the worst. And really, there's a clustering of much higher prevalence in particular urban centers and coastal communities. And not all coastal communities, if you look on that map where the red is happening, it's particularly the most deprived coastal communities. And I forgot to put up a map of the local area here, but I'm sure you all know where the particular areas are for your community. But if we're talking about young people, actually, my big ask for national government is there's no data on the prevalence of youth mental health at a local level. It's not there. That's what I had to show for all ages. So that's one of my asks. So we had to turn to survey data. So we were looking at this national level data, this Understanding Society data set, and it surveys households from all over the UK, about 40,000 people, and it re-interviews them every year, and particularly young people. So you get a really good idea on a national level what's going on. And they also have this youth survey. So they said all of the young people, 10 to 15, we have this particular survey for them. And then because they followed them up over time, they've got up to 12 waves of data. So we can say, a lot of things are correlated with each other when you talk about health. You can say, oh, well, on that map, there was more mental health in this place, but it's not causal. You have to say, let's look at what they were exposed to, follow them up over time. So we took those young people in the survey and we said, do they live in a coastal area or not? And actually, there's no official definition of what coastal community is or is not, but we've chosen one and then kind of looked at that. So you might want to think, do you feel like you live in a coastal community? How far away from the coast do you think you would have to be to not be in a coastal community? And are you near the sea or the estuary? Does that matter? But we've got our own definition. We said, do they live in a coastal community or not? And then we followed them up over time, up to 12 years later, to look at their mental health. So we can say this is causal. And this was really the first paper that came out of this. It's a complicated graph, but basically on the left, it's showing the level of mental health. So if you're going from 40 to 46, if you go up, it's better mental health for young people. Along the bottom there is area deprivation. So all the way to the left, 1 is least deprived areas, and 5 is the most deprived. And the little jagged lines is the coastal, those young people living in coastal areas, and the other one inland. And what you see is that in the least deprived areas, like kind of 1, 2, 3, there's really no difference between coastal youth and inland youth. But when you get out to the most deprived areas, the top 20% most deprived, that gap is widening hugely. And it's telling you that young people who live in the most deprived coastal communities have much worse. They're saying their mental health is much worse than even their peers in inland deprived communities. So equally deprived. And this was quite shocking to us. And this is after adjusting for lots of things about their household and them personally. And that it's a difference of about almost 4 difference gap. If you look at other papers about, if you see a gap of about 5 or 6, that's equivalent to the change in mental health someone has the year after they've been bereaved from a close family member. So it's not a small gap. And so we said, and we also saw this with psychological distress, with long-term limiting illness, and not so much about physical health. So it was really saying there's really a mental health problem for young people in deprived coastal communities. And we're like, what is going on here? Why would this be that just because you live by the coast, the mental health is worse? So there's lots of research out there saying it's really good for your well-being to live by the coast. You've got blue space, better mental health. I'm from a coastal community myself. I think, you go to the beach, it improves your well-being. You feel better. People retire to the coast, they move to the coast because they like being there. It feels good. So why would these young people have the opposite? And so we really tried to think about what those possible mechanisms are. And we've partnered with The Guardian this year on a series that they're doing on young people in coastal communities. It's a really fabulous series. I would go look at it, this Against the Tide. And they've been going out and interviewing young people in lots of different coastal communities around England. I think Wales is coming. And I really love this picture because there's a young man from Blackpool. And he's saying, if you hear your town is scum all the time, that sinks in. So I think really what's come out a lot is thinking about stigma. Like there's certain places like that you say, I'm from this place, and people kind of go, oh, they judge you right away. So one thing, also talking about lack of opportunities, issues around employment, occupation, a big story about economic decline in lots of these deprived coastal communities where tourism, international air travel comes in the 70s, people go to Spain, they don't come to English seaside resorts so much. And thinking about fishing industry, portside industries, you've seen this economic picture of decline and young people experiencing that. But you've seen that in urban centers as well. And so we think it's more, you combine that with the geographic isolation, with transport issues. It's much harder. Let's say you can't find a job locally, it's harder to go somewhere else to find a job. And also issues around decline in youth centers, kind of infrastructure in these places. So I think it's a combination of these. But that's a theory. These are our ideas of what we think is going to happen. So we wanted to test these out. And so we wanted to say, is this something about the environment of coastal communities? Is it something about where people live that's influencing the mental health? Or is it about the combination of the kind of things that people are experiencing there socioeconomically. It's about income, housing, that kind of thing. Or is it about healthcare? And so I'm going to very, very quickly go over what we've been finding with these. So for environment, so we tried to think to ourselves, what are all the potential environmental exposures people could have, these young people are having in coastal communities, looking in the literature, and which ones are also related to mental health. So you've got the economic story, things about unemployment, economic inactivity, productivity, that whole economic story I was talking about. Then that more leads into, if you're thinking about a young person, thinking about the future, you want to go have a certain occupation. Do you have other people around you who have those occupations that you can talk to? I think my arrows have gotten a little bit messed up. Thinking about crime levels, there's a lot of literature around crime affects mental health. Thinking about educational environment, the quality of the schools, can you participate in further and higher education? And thinking about the built environment. So if you have a health problem, how far away is it? Can you get to the GP? Can you get to the hospital? Can you get to employment? And also thinking about air pollution and green space. And across the board, this is all local neighborhoods in England, the coastal places have worse levels on average than the inland places. And that's a very crude comparison, but I think it speaks to a lot. Not so much the built environment. These were like 1 minute differences in travel time, so I'm not going to talk about them so much. The only ones, but some good news is there's more green space and there's less air pollution. So you've got that going for you. But we saw this same pattern in the survey members, so in the young people who filled out the survey. And we saw this within the people that lived in the top 20% most deprived areas. So to me, saying, even if you live in the most deprived coastal communities, you're experiencing these worse levels of economics and all the things here than the inland deprived areas, which I find quite shocking. But if we were talking about mental health, there was only 2 environmental variables that were related to the young people's mental health later on, 12 years later. And that was crime levels and progress to higher education. And I don't think it's just talking about progress to higher education. I think it's a proxy for being able to go on to further and higher education. So, and this is after adjusting for lots of the individual socioeconomic stuff. So this was quite surprising to me. Out of all those environmental things, it was just these 2 really that were related to their mental health later on. And then we wanted to say, okay, which one of these, the environmental factors or the individual factors, are most related to the mental health? So this here is showing these numbers, the average mental functioning score. So they've said in the survey, this is how I feel in the last 4 weeks about my mental health. And I showed you that gap between the coastal deprived areas and the inland deprived areas. If you only adjust for age, it's about a 5 level average gap. If you add in the individual factors like sex, ethnicity, can you see that? Household income, tenure, it goes down a little bit to like 4.3. So it's explaining about 16% of that gap. If you add in the environmental factors, the local crime, it actually goes the other way, so it's not an explanation. There's a bit of negative confounding. If you add in participation in higher education, it only explains about 8%. And if you put in all of those things, it explains about a quarter. So my interpretation of that is this is much more about the concentration of low income and private renting in these deprived coastal communities than it is about the environment around. It's a little bit about progress to higher education, but it's saying it's more about concentration of poverty, really. But we've only explained about a quarter. Still have more to look at. So love to talk to you afterwards if you've got some ideas about things we could look into next. This is one of the last slides about what we've been finding. But we also wanted to look at healthcare. Because I was thinking, okay, so if you're a young person and you're saying, I'm distressed, I have mental health issues, have you been diagnosed? Are you able to get treatment? And so this is the same figure here, where 5 is in the most deprived areas, but this time it's showing the prevalence of diagnosed and undiagnosed mental health. And along the bottom here, the red and the yellow is diagnosed mental health inland and diagnosed mental health in coastal areas, and those are quite equivalent, a little bit higher coastal. But the green line is showing the prevalence of undiagnosed mental health for coastal. And then if you look in the most deprived, there's a huge uptick in undiagnosed mental health for these young people. So these are people about 16 to 24. So I'm sorry to give such a negative picture. But this is me saying this is a huge problem. And so essentially what we're saying is these young people have a double whammy. There's a higher prevalence of mental health in these top 20% most deprived communities, and a lot of them are not getting help for it. They're not getting diagnosed. And so far, this seems to be much more about a higher concentration of poverty, low income, housing. But we've got a lot more to look at here. We need to really investigate what's going on with that other 75%. So that's me calling out the big issue. This is saying this is what we found. And I want to move on to a little bit more about, so what are we trying to do about it? On an academic point of view. And I think what we normally do in academia is we go out and we interview people. And so this is a project I'm doing with UCL colleagues, where I've been going out and interviewing lots of young people in coastal communities, but also stakeholders, so people working in youth services, local government, etc. These are colleagues of mine, and we've been asking them to say, how do you feel about the place that you're living, your coastal community? What could we do to make it better? And they're saying for young people, these were the things that came out really strongly. And they said a lot of young people said, we don't have anywhere safe to go and to socialize and to be with our friends. That a lot of the youth services have disappeared. The touristy beach areas, they feel like they're not for them. The town centers aren't that great in a lot of these places. So they're saying, I just really don't feel like there's somewhere I can go and socialize and be with my friends and that it'll feel safe. And this has come out across lots of different places across England. So we were saying sustainable funding. They're saying lots of short-term projects, like maybe get funded for a year or 2 or 3 years, and then they end. They say, this really worked. It was really fantastic. Funding's gone. I'm sure you would say the same thing. Improvements for employment and educational opportunities, saying there's a real lack of those for young people in these areas, and regenerating infrastructure. I'm sure I can see people nodding, yes. But this is a one-way street. This is what people have told us. What we'd really like to do is to be working in partnership, and I think that's what this event is about today. The first place that we've started is to try to work with our networks as well, because there's a lot of interest in coastal communities. I think it's a time where lots of people are really paying attention. People want to do something about this. They're aware of the issues. It's been going on for a long time. And so if you want to get involved as well, I really think it's a good place to start. There's Coastal Community Alliance, so that's local government. CoStar Network is about coastal resilience and climate change, so that's more academic. Breaking Barriers has a new Coastal Navigators network of integrated care boards. I think the Apollo project is a part of that, and they're really growing and getting going. CODA is Coastal Data Network, so that our academics like that. So lots of data stuff. And then of course on the national side, so there's an all parliamentary group for coastal communities. but also this key cities one, a lot of the key cities are in coastal cities. So if you want to get involved, so we've been trying to bring the work to the national level, to the local level, what I'm doing today, talking with you, and say, we have this problem, what do we do about it? What are we going to change? But again, so I'll just give a few examples of thinking about how we're doing academic and community partnerships. Because as I said in the beginning, we want the center to be about working for our coastal communities. And I feel like each of us has a little bit of a piece of that puzzle. That's why I put this picture up here. On my side, I've got the data, I've got the analysis skills, but I'm not down on the ground. I'm not seeing, what's happening there. And the things that I've learned the most is just from having conversations with people in coastal communities. That's been the most valuable thing I've gotten back. So I've got the numbers, I've got the data, the statistics, but I don't have the stories. Right? So we've been really lucky, just recently, have been able to get a lot of funding from NIHR to do a 5-year project in Essex, Thurrock and Southend to really dive in to say coastal youth mental health, what's going on in that area. Susan and Vicky, so Vicky's just been hired as a professor of applied mental health, and we're really just getting started and saying we want to work with our local communities to build, a partnership, because we know there's lots of really good projects. People have been working on doing lots of good things locally for a long time. They know what's going on the ground. They know what needs to be done, and we need to be talking with them. We don't need to be coming in as academics and saying, we've got this money, and we're just going to take over and tell you what to do. It's not like that. So we're trying to build a partnership, build a group of people to address this issue together. But it's just getting started, and really tackling the issue of loneliness and social isolation in young people in those areas. And it's a partnership on lots of different levels. It's a partnership across the university, so we have a team that's working in lots of different areas. So it's led by our Institute of Public Health and Wellbeing, but we've got people from coastal communities, from Institute of Social and Economic Research, social sciences, etc. And then we're linking with King's and Cambridge, because it was a funny kind of grant where they said you have to get people with more experience with mental health to help you. But the whole point of the grant is when we were looking at the numbers of funding on doing research on mental health, all of it goes to London and Cambridge. Like hardly any of it comes out anywhere past Cambridge and the East of England. And we said, so we need to know what people in the East of England think, what's going on here, not just Cambridge and London. And these was the initial partnerships that we had at our launch event. But I didn't want to put any logos up if they hadn't said it was okay. But I'm hoping that this will be filled with our partners next year. And the other ways that we're doing is not just saying we're getting a grant and you come join us, but we also have these knowledge transfer partnerships. So Mind Mid and North East Essex has partnered with our Institute of Public Health and Wellbeing and Business School and wrote a grant together to this Innovate UK. And that means we could hire a researcher to go to Mind and do research there with them, kind of bring our data analytic skills to help them from the academic side of things. So I think that's a really nice little way of doing it. So the person is actually there at Mind and then supervised partly by academic staff. And you can get money from Innovate UK. And I have to say that Essex is #1 in KTPs. I'm just learning about all this, it's not me, there's a whole department. But I think this is an example of way that we could work in partnership as well. But I'm going to stop there. I think just those examples. But I want to say, what are the other ways we can work in partnership I should also say, so as academics, I also have joined, not on mental health, but a grant to look at culture and heritage and creativity from the Arts Council. So Tendring Council has won a grant that we're going to join to help evaluate the program. So I'll show on the evaluation side, etc. But as I said in the very beginning, I think if we're going to solve this very big issue about youth mental health in coastal communities, it's not going to be just us academics up here solving it. It's going to be everyone in this room, including, and then you add on national government, other government, to really do something about this. So I will stop there. So if you'd like to contact me, that's my contact information. And thank you for inviting me.